training is an important part of ACL repair at numerous phases during the rehab process. There's a lot of variability when it comes to postoperative weight-bearing status, depending on the surgeon and repair types. Progression should be individualized based upon each patient's specific needs and the surgeon's specific guidelines. Clinical benchmarks need to be reached before you advance to the next phase of rehab. In the initial 3 weeks following surgery, the goals include edema management, increasing quad tone, achieving full knee extension, and knee flexion beyond 110 degrees. Normalizing gait is very important in this phase since compensatory patterns can impact the repair. Gait training in the AlterG should begin as soon as partial weight bearing is allowed. Unweight the patient to 50% body weight and add or remove body weight until normal gait that is pain-free is achieved. Focus on achieving full knee extension at heel contact, full extension in mid-stance, and flexion to 65 degrees for normal swing. Progressively increase loading over the first 3 weeks. Goals in this phase typically include safe restoration of range of motion to near full, as well as improving single limb stance tolerance. The ability to perform 10 squats to 30 degrees without pain is a good goal during this phase. The AlterG can be used after week 3 to introduce squatting, single limb stance, and calf raises if pain, strength, or swelling are limiting factors. Provide varied support as needed to allow patients to perform these exercises pain-free and use the support to focus on proper biomechanics. Gait training should continue on the AlterG for walks longer than 10 minutes. Continue to progressively increase loading until gait is no longer compromised over ground. At this point in a patient's rehab, the focus is primarily on restoring strength to normal as well as achieving full range of motion. Use the bodyweight support of the AlterG as needed as you transition a patient to performing their long walks to over ground. Exercises to strengthen the glutes, quads, and calves may include retro walking at a slow speed to activate VMO, single leg squats, or slow step downs off a 4 to 6 inch step. After the initial 10 to 12 weeks of rehab, the patient's goals are centered around full return to sport and running. The AlterG can be a great tool to reintroduce running after an ACL repair. Use only the amount of bodyweight support needed to allow a patient to run with good mechanics and no pain. Keep the incline somewhere between 0 to 5%, depending on a patient's recovery. Check out our other videos for more specific examples of return to sport exercises that can also be completed in this phase. Remember that this protocol is just a general guideline for the progression of a patient after an ACL repair and ways to incorporate the AlterG treadmill in their recovery. This protocol does not substitute for professional clinical decision-making and should be individualized based upon specific surgeon guidelines and each specific patient's needs.